Welcome to another edition of Currently in Quincy. I'm Joe Catalano, and on today's program, we get to talk with Cynthia Sierra from Mannett Community Health Center and learn about their COVID-19 vaccination clinic here in Quincy. First, though, we check weather and news for you. Currently in Quincy, cloudy. We'll see some off and on rain showers, maybe a snow shower mixed in today. Temperatures will climb into the lower 40s this afternoon. It's 36 degrees right now. Should clear out tonight. Temperatures drop to the low to mid 20s. Tomorrow is the pick of the weekend. Lots of sunshine, kind of breezy, but mild again. Tomorrow's highs right around 40 degrees. Look for some more snow on Sunday, mostly in the afternoon, with potential for a few inches of accumulation by Sunday night. And temperatures Sunday into the mid 30s. Sunshine returns here on Monday along with the colds, with a high Monday right around 30 degrees. Again, some showers around 36 in Quincy right now. In the news today, the Quincy Planning Department is being called COVID-19 heroes. The City Council earlier this week honored members of the Planning Department for their efforts to help individuals and small businesses during the pandemic. The Council President Nina Liang said that their efforts to administer financial assistance helped to keep people in their homes and help keep businesses open.
Allocated nearly $2.5 million in grants to almost 400 businesses here in the city. The average grant size was $6,500, and almost 90 businesses, which is about 25%, received the maximum grant of $10,000 each. For most businesses, this meant that it saved them from closing up shop. 41 of these businesses were women-owned, and 30% were minority-owned. And again, here in this city where we have such a large minority population, this was huge in making sure that we're sustaining the local economy. This program that was put into place is considered to be a regional and national model. And our senior principal planner, Liz Manning, and finance director, Neil McCall, has actually given presentations about the city's response to Southern New England region of the American Planning Association and to the National Community Development Association.
The Planning Department worked with the Quincy Chamber of Commerce and Quincy Community Action Programs to administer grants and loans to pay landlords and to help businesses pay employees, rent, and other expenses. The council has been opening each of their meetings by honoring a COVID-19 hero. 4 more police officers recently joined the Quincy Police Force. Brenna Callahan, Nick Frasso, John Ryan, and Cornelius Koch, the son of Quincy Mayor Thomas Koch. All 4 graduated from the Police Academy in Plymouth in December and are currently in field training. All 4 officers have or have had family members in law enforcement. 15 new officers have joined the Quincy Police Department over the past month. Last Sunday, Quincy firefighters rescued a dog that had fallen through the ice at the Granite Links Golf Course in Quincy. Quincy firefighters Local 792 shared this video of that rescue of the dog, which belonged to one of their members. Firefighters wore protective suits to brave the frigid water and bring the dog safely back to shore to be reunited with its owner. Well, the second annual Parade of Puppies fundraiser for the Quincy Animal Shelter will be held at Marina Bay this Sunday. The parade begins at 1 p.m. with puppies decked out in their Super Bowl Sunday best outfits. Dozens of puppies participated during the inaugural parade last year. The parade is an outdoor event. All state and city mandated COVID-19 regulations will be enforced. Now, funds raised at the event will go toward construction of a new Quincy animal shelter on Quarry Street. Coming up, we will get details about the COVID-19 vaccination clinic in Quincy next.
Hey, Massachusetts, what do you want to get back to?
Giving hugs, seeing my friends.
Taking my wife dancing.
I want to get back to taking my kids on play dates.
I want to get back to Fenway.
I want to get back to partying.
We've worked hard, but we're not there yet. So we still need to wear a mask that covers your nose and mouth. Keep our distance, at least 6 feet apart. And get tested. It's free and available. We can get back masks. Learn how at mass.gov/getback.
Podcasting 101. Create your own podcast using the QATV audio suite. Learn the basics of the audio board, how to take phone calls, and add music from a CD, SD card, or your phone. Participants will also learn interview skills to help get the most out of your guest. To register for a session, email Carol Themin at cthemin@qatv.org or call 617-376-1440.
I think I finally found.
Hey, how you doing?
Hey, Mason.
Hey, Mason.
Got a new house. It's looking pretty cool so far.
A place that I call home.
I'm teaching Louise how to cook some lasagna.
It only takes a spark to make a fire start.
The Dutch.
Thank you.
Study, please.
I think I finally found a place to make my own. A place that I call home. This place that I call home.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor, artist.
Bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
Happy to welcome back to the program Cynthia Sierra, the CEO of Manic Community Health Center here in Quincy, who are playing a critical role in this pandemic. Cynthia, nice to see you again.
Good morning. It's great to see you as well, Joe. Thank you for having us.
It's our pleasure. Certainly, as I mentioned, Manic really has been on the front lines since the outbreak of this pandemic, coming up on a year now. And the very latest is providing vaccines here in Quincy, right?
Absolutely. And it is amazing that it has been a year, Joe, and to reflect on the fact that also within a year, we appreciatively have a vaccine that we're having this conversation about, Joe, and, frequently sort of start and end every Manic Day with that top of mind that, what an amazing opportunity that we have, all of us as citizens and certainly as a community health center to help distribute the vaccine. And at the same time, as we discussed talking just a bit before we came on, the opportunity to continue to do testing and how important that is as well as we hit this 1 year mark here in the city.
Yeah. So if we could, let's talk about the clinic that you're running at 180 Old Colony Avenue and how it works.
Absolutely. So just actually coming back, my office is in North Quincy on West Squantum Street. And so was just over there this morning for a bit to check in with the team. And it is off to a wonderful start. We had some soft opening practice work, if you will, last week, but 75 plus formally opened. Our 75 plus vaccination community clinic opened on Monday of this week. On Monday, Joe, we frankly had the privilege of vaccinating 160 75 plussers. Yesterday, we vaccinated 180 75 plussers. And today is what we call our dose 2 clinic. And so over at 180 Old Colony today, phase 1, dose 2. So we have first responders that will be providing that second dose and other essential workers that touch the lives of the residents in the city. So just a wonderful operation to see. A tremendous partnership from the city, Joe, but the call to action, if you will, not just from Team Manic, and I'm quite biased, they're exceptional people that work for this health center, just exceptional people, but also volunteers that are lending a hand and opportunities to do that we're so pleased about. So, and I think their session is off to a running start, Joe. So it's good to see.
We've heard concerns about limited supply of the vaccine. Have you seen that at Mannett?
It certainly is a concern, Joe, for all of us. I think for Mannett, we've been fortunate that we've been able to continue the momentum of the vaccination. So in phase 1, we, as I mentioned, we're doing dose 2 for phase 1ers, if you will. But for phase 1, we were able to keep a steady pace and vaccinating our own healthcare personnel, first responders, staff at our homeless serving congregate care organizations, dentists that serve the residents of Quincy, and alike. And so we actually were able to keep that pace, and the doses were available to us. And each one, as you can imagine, is recorded in the state's registry system. So there's a really good mechanism of tracking dose volume, and you continue to ask on a weekly basis for a replenishment, Joe, of those doses. And like all of us, trepidatious that we don't overcommit the resources and the capacity. And so just very respectful about that message that that there is and there has been and there can be a wait. Do we think that's going to be alleviated in the coming months? Yes, Joe, for sure. Things seem to be looking better, and for health centers as part of that larger healthcare environment and family of providers, for sure, where we're continuing to look ahead into those different steps of phase 2, but also phase 3. But it would be irresponsible to say that there was a plethora that was available and unfettered access and supply. And there's also a new vaccine that we're all paying much mind to from Johnson & Johnson. Soon after that, we expect AstraZeneca. So for right now, what healthcare organizations are using, Moderna and Pfizer. And for Mannett, it's Moderna that we are using and administering.
Now, for folks who do schedule an appointment for a vaccination, does that schedule them for their second dose as well, or do they have to, schedule a second dose separately?
So, Joe, that is an excellent question. And it's really important to say this. When we all speak about vaccine scarcity and supply and those chain issues that can happen with inventory, what we have consistently heard and what we've seen is that we do not have to worry. If someone has been given that first dose, they'll be given that second dose. And that has been a commitment of the governor and the command center that we have seen surely realized with all of their efforts. But the operational end of it, Joe, is also what you're speaking of. And I will say, when we were first getting our vaccination program off the ground, we were imperfect, and we're still improving our processes all the time. So you wouldn't necessarily leave with your second dose appointment. Joe, I'm happy to report that whether you're inside of the health center practices, and we have 5 of them, or you're over with us at 180 Old Colony, you will have your second dose appointment. So you will have that confidence that that you're going to know when you're coming back to see us. And with Moderna, it's usually at or around 28 days.
Okay, and that is the vaccine that's much easier to store, is it not? It doesn't require the super cold temperatures that Pfizer does. Exactly.
And Johnson & Johnson is going to be interesting to see because that might not require any. Yes, exactly, Joe. So it's more moderate to be able to store. It's not as fragile. And that's important because there could be a moderate amount of travel, right, from the vaccine hub to a site, as an example, like 180 Old Colony. So our clinical team led by Dr. Lily Young, very comfortable with Moderna for sure. Yes, and you'll hear of some organizations are working with both. Hospitals are working with Pfizer, and to your point, yes, because they have that capacity for the sub-zero refrigeration and can store more volume, and then also, if you will, turbo generation, right? So.
Could you walk us through the actual process, Cynthia, of when somebody walks in to get vaccinated? What the actual?
Absolutely, yes. So if you were to walk into 180 Old Colony today, you walk into the lobby. And there's two different entrances into the lobby. You'd be greeted by registrars, if you will, that would confirm who you are, register you into the system. You would then take leave into a smaller reception area, and 10 at a time as an example. You would be provided, if you will, sort of an introductory elevator speech as to what your experience is going to be like, what the implications of the vaccine, and what it does and how it protects, its mRNA background, any side effects that you might experience. And then you're brought back to a much grander room where you'll see an abundance of chairs, and they're spaced. And so everyone will take their particular chair. They'll be escorted to their chair. And there's 3 classrooms that are repurposed, if you will, into nurse exam rooms. And that's where you have a little bit more discretion and privacy. And you'll be called in and escorted in, provided your vaccination by our team of our staff nurses, our volunteer nurses. And then you can't leave, Joe. You have to stay with us a little bit. We have large clocks on the wall, digital clocks, and signage everywhere you go. And you have to stay with us, if you will. Stay masked, really important. Stay distant. And we need 15 minutes to observe folks. And for some, Joe, that might have allergies, they need to stay with us for 30 minutes and enjoy each other's in our company. And we have a clinical team that's there and at the ready. In the event, and it is rare, Joe, but in the event there's any adverse reactions to the vaccine, we just have that duty and obligation to be there at the ready. Safety has to come first. And that's why even, for folks that have a hard time spending that time with us and they're busy and they want to be mobile quickly, we just really call for them to stay with us for 15 minutes. And then they're on their way. You will see MANET staff, MANET volunteers while people are in that observation period, whether it's 15 or 30 minutes. Most people are 15. Check in with you. How are you? Is there anything that I can do for you? Is there anything that you need? And then they're free to go. And until we see them again for their second dose. And then they will come through the same process, Joe. They just will have probably a different, if you will, content in their opening wayfinding speech, because it's a second dose and there's different information to share. And then also these are folks that are sort of, fit tested and really ready for that second dose. And their registration process and sort of wayfinding process is a little bit different because they've been with us before. So whether here in North Quincy, where they had their first vaccination before we moved over to 180 Old Colony. So our goal is to give each member of the community that comes to us a really good experience of a vaccination clinic.
And what documentation, Cynthia, should folks bring with them?
Yeah, that's a great question. So when they register over the phone or they register on our website, they are putting in their demographic information, Joe. For right now, as an example, to register on our website, you have to, check and assert that you're 75 and plus. You do need to bring ID if you have it. If you are in that phase 1 first responder category, because phase 1 and phase 2 are still overlapping a bit, you'll have to bring identification vaccination card, if you will, as a first responder or an employee of a shelter organization or such. Yes.
Okay, very good. And I know the city also is running a call center to take appointments, and that is 617-376-1470, or for Chinese language assistance, 617-376-1298, or through the city website, as well as manatchc.org.
Yes, absolutely.
Yeah, and is the testing also going on at 180 Old Colony, Cynthia?
Absolutely, Joe. And thank you for that question. Testing continues to be of the utmost importance, Joe. And we are also testing on Tuesdays at 180 Old Colony. And Joe, contrary to vaccination care and service at the community vaccination clinic, the Tuesday community COVID-19 testing clinic is walk-in. No appointments are needed. And an exceptional team led by Kim Kroger is there between 12 and 4 each Tuesday. Joe, this past Tuesday, you can remember Monday we had that slushy precipitation. It got really cold. We did go forward. We opened up on Tuesday, 12 to 4, knowing that the commitment to testing all seasons, all opportunities we have to test, we should. 230 folks came to see us.
Wow.
Yeah, and so in the 6 weeks that we've been testing in partnership with the city, Joe, over 1,200 persons have come to see us for a COVID-19 test, and so tremendously important because within a 16, 24-hour period of time, we're getting those results back to folks that come to see us. There's no insurance information, payer information, if you will, that's asked for. There is demographic information that you do need to provide upon entry. We also need emails to be able to communicate what comes up most, which is negative results for folks. And we believe it's a really seamless, comfortable process for folks with a self-administered swab. But so important to have that testing access. And Joe, if I could also make mention of 6 days a week, Manat provides COVID-19 testing, and this is by appointment, and you can make appointments by calling us or direct from our website. We've received really great feedback from community members and our patients on our testing registration link that's on our website. So Monday through Saturday, occasionally there might be a Saturday that we're not testing, but most we are. We have a separate entrance for COVID-19 testing, a separate area of the health center off of the vestibule at 110 West Quantum Street. And yes, 6 days a week by appointment we're testing. Joe, our own registered patients, but anyone can come and see us. Even if you haven't had a visit at Manat before, the goal for us is to make sure that there is unfettered access to testing. Joe, if I may, we also test at our Hull location, and this is important because if for some reason all of the appointments are taken in North Quincy, or someone lives in Quincy but works in Hull, someone works in Hull but lives in Quincy, etc. We know there's a lot of synergy there. So we actually also, and you can make appointments from our website, we test each Wednesday afternoon, Joe, at Manat Hull on the lower level from 12 to 4. And so there's a team that's there to greet and educate and provide COVID-19 testing. So I also wanted to share that for you. If I could, Joe, testing also continues to be so important, and along with vaccination, and why. And we're helping to sort of dispel a myth that the COVID-19 vaccination will keep you from getting COVID. Joe, we don't know that yet. We can't quite say that. And so it needs to be understood that any of us, Joe, that have been vaccinated, it does not mean that in an asymptomatic way, we're not shedding, spreading, or sharing the virus, right? What the vaccine's doing is it's keeping us from getting sick with COVID, right? It's stemming the tide of those impacts, and some of them, have led to, great loss. And so, but you can still contract COVID and share it. So it's so important, Joe, that we get that message out. And so appreciative that of QATD and the work that you do, because we need to wholly understand that and why testing continues to be an important complement to a vaccination program.
It's a great point, certainly, because if you do find out that you are positive, you're able to take actions like quarantining and masking so you don't spread it, right?
Absolutely, Joe. And you can do contact tracing, right? Your own contact tracing, but with public health professionals. And we can do our due diligence. And as an example, colleagues, family members, to make sure that they're taking precautions. And they also know the pathways to get tested too.
Sure. And can children also be tested, Cynthia?
So at Mannett, we do test children that are 5 and up, Joe.
Okay.
There is a predisposition here at the health center. Frankly, if adults in the home, caretakers, grandparents, foster parents, parents, our aunts and uncles are COVID positive, Joe, children often can be positive as well.
Right.
And so, but we can test the kidlets as long as they're 5 or up. We don't test any younger. The clinical team here, our physicians and nurse practitioners and physician assistants will, if you will, care for that whole family with the assumption that that little one could be impacted by COVID as well.
Sure. Okay. And are you anticipating keeping the vaccination clinic going through all the phases here in Massachusetts?
That is our hope and our expectation, Joe. I think we're committed to the good health for the community. We truly understand that our primary care patients, the community at large, if we can be a resource, we want to be that. We're already planning here for sort of the next stage, if you will, in phase 2 of vaccination service. So including, but not limited to, 65 to 74-year-olds. And also, Joe, I wanted to share for our primary care patients that are 75 and up, we feel really positive about the fact that also in our health centers and community locations, also we're in Taunton as well, that we're testing and at community sites too. So doing all of our outreach right at the ready with the guidance of our clinical teams to outreach to all of our patients 75 and plus. And Joe, you may have heard, but on opening day at Olney Street, we had the honor of vaccinating a 102-year-old wonderful woman named Dorothy. So what a wonderful opportunity and a privilege for all of us to be able to help provide this service, and as quickly and hopefully a deeply thoughtful way. And we'll be able to expand and do more as vaccine inventory also is supplemented too, Joe.
Yeah. What does this mean for you personally and professionally, Cynthia, to be able to, lead an organization that is so critical during this unprecedented time?
Wow, Joe, that's a really good question. Joe, it's almost hard to put into words what this year has been and what this team has done and what this health center has meant to the community and our patients. From my point of view, it's a very moving time. You can't help be moved by the work itself. You can't help but be moved by the volunteers that step up to join this greatest cause, if you will, for many of us of our lifetimes. And it's always, Joe, top of mind. It has, in my mind, brought out the absolute best in the city. It's brought out the best in our colleagues. It's brought out the very best in every staff person that works here. We have the most magnificent board of directors. You know, we're led by our patients, Joe, and boy, they have been magnificent. And it's just an honor. But you know, I've always been biased about community health centers, Joe, that every community needs a community health center. And we've been preparing for emergencies for quite some time. It's core to who we are and what we do. We see community health center as an extending out into the community, and public health is tremendously important to who we are and what we do, keeping the environments and the neighborhoods healthy, sort of looking beyond our own walls. This is what we've done, Joe, and we were started by the community. I mean, we were started by the community, by residents in the city of Quincy, that recognized that there was not enough healthcare access. And so I think about those founders as well, and I hope that they're proud and pleased of this health center, and how we've done our very best to lend a hand. Community health centers are I think, magnificent organizations, and just sort of at the ready. And it's sort of, what can I do for you today? So I have the opportunity to be inspired every day, and just by this cause, and yes, and let's be reminded, Joe, we have a vaccine. We have a vaccine, right? And that is my first thought and my last thought at the end of a Man at Work day. And also just knowing that it takes each and every one of us, and it's built stronger teams for this, right? So if there's any sunshine in a pandemic, Joe, that's it. It's the strengths of the teams that you've built. It's if you will, the security, knowing that you can lean on those partners, and the confidence that you have that that we truly are. It sounds so cliche, but we're truly in this together, right? And just that reminder of how important health is, but as important how we treat and respond to each other. And part of that is getting the information out that people need in a timely way.
Yeah, thank you so much for sharing that, Cynthia. It's great insight, and I think for over 50 years now, the city has been blessed to have Manat here in Quincy. So at a time like this, I think it really shines, and it shows its importance. Certainly, we want to give out those phone numbers once again for folks to schedule their appointment for a vaccine at the City Call Center at 617-376-1470, or for Chinese assistance, 617-376-1298. The city website, quincyma.gov, and Manat's website, certainly, manatchc.org. Anything else that you think we're forgetting right now, Cynthia?
I think that's great, Joe. Thank you. Yes, and on the Manat homepage, wonderful information and resources for all of us on testing and vaccination. So hopefully you'll see those as educational pages, but also registration pages and links.
Great. Appreciate your time. Please reach out if we can do any more here, but we're happy to help.
Thank you, Joe.
You're welcome. Bye-bye.
Recapping the weather forecast for the rest of the day today, look for a rain or a snow shower. Temperatures hovering Right around 40 degrees. Things will clear out tonight and the temperatures fall to the upper 20s. Sunshine returns tomorrow, breezy but pleasant. High tomorrow right around 40 degrees. Snow returns here on Sunday, mostly in the afternoon. Could be anywhere 3 to 5 inches of accumulation by Sunday night with temperatures into the mid-30s. Clears out again Monday. Sunshine returns along with the cold. High Monday only barely 30 degrees. Thanks again to Cynthia Sierra for joining us today from Manac Community Health Center. Thank you to our crew. Thank you for watching. On Monday, we'll touch base with members of the Quincy Symphony Orchestra. And a reminder, please visit our website. Go to qatv.org. You'll find all of our latest programs, news and information, online classes, video on demand, live streaming, and much more. For all of us here at Quincy Access Television, I'm Joe Catalano. Please stay safe.